So what does a fentanyl overdose look like when they come into the emergency department? There's really a couple of three telltale signs, I think. So one is we would say they have a decreased level of consciousness, or they're unconscious, right? They're not responding. They're not answering questions. The second thing is we would see pinpoint pupils. So we very, very, very small pupils. And the third thing is usually they have a very slow respiratory rate or breathing effort, or they're not breathing at all, and someone is helping to breathe for them, being the paramedics often assisting with their breathing that way. Well, those are kind of the three telltale signs of an opiate overdose that we tend to see. So if that comes in, there's this medication. It's called Narcan or naloxone. And it essentially is a medication that reverses opioids from the receptors. So it kind of knocks off those opioids from the opioid receptors, which therefore now you would no longer have the effects of that opioid. So then you would see an improvement in their level of consciousness, improvement in their breathing, their respiratory rate, and usually their pupils would get bigger as well as a result of that.
Brodie, do you ever call it the EpiPen of opioids?
Oh man, I feel so dated now with the med students that are coming through. But every time I try to describe what giving Narcan looks like to someone who's never seen it before, I talk about Pulp Fiction and how Uma Thurman gets like the epinephrine injection to the heart. It's like, that's it. They go from like being like a table, like they're not responsive. You could like, hit them as hard as you want. They're not going to move. I don't hit my patients. But like that's the level
anymore.
Of like,
you got reprimanded for that one. You learned.
Yeah. But they go from that to like being like up and awake and running, and it's yeah.
I think it is important. It is important to note, listeners, Narcan does not get injected into the heart.
Yeah, you did it wrong.